Good morning. I'm originally from Brazil, and as a nation, we believe that God is Brazilian. God is Brazilian. This can be a little bit suspicious, but in spite of the fiasco in 2014, no other country has won the World Cup soccer tournament 5 times. As Brazilians, we are very proud of our record. Miraculous, right? We have gorgeous, heavenly ocean views and mountains surely made by the hand of God. And speaking of divine, our happy, beautiful people. The list goes on and on. Yes, I know. I started my scientific career in Brazil. My first project was to develop a gene therapy model to treat HIV infection. Sounds fancy, right? Yes, it was fancy and challenging, especially in a country with limited resources. I will never forget my advisor's wise words. Aufra, do you know the origin of the word laboratory? I will break it down for you. Labor, from Latin, means, or labor, as we say in English, means to work hard, to make a great effort. Oratory, also from Latin, orare, means to pray. It can also mean a room for prayer. Therefore, laboratory is a room where you work hard and pray for quality data, meaningful results, from where you can draw relevant conclusions and solve a problem. Okay, I got it. That has been the story of my career through my master's, my PhD, my postdoc, and several years of working at CDC. You can talk with any lab scientist and they will tell you the same story, putting a lot of effort and long hours of sometimes tedious work in the lab to standardize an assay, understand a mechanism, or develop a new method. Patiently, but steadily moving, one step at a time, getting closer to answer meaningful public health questions. I'm an alumna of the Laboratory Leadership Service inaugural class of 2015. And 2 months into the program, I was asked to serve the agency. It was towards the end of the Ebola outbreak response in West Africa. The countries affected were Guinea, Liberia, and Sierra Leone. By September 2015, when I deployed, there were few cases reported in Guinea, near the border with Guinea-Bissau. Guinea-Bissau is this small country shown in red, squeezed in between Senegal and Guinea, where the Ebola outbreak was occurring. Similarly to Brazil, Guinea-Bissau is a former colony of Portugal. Thus, their official language is Portuguese. Because of my scientific background and my ability to speak Portuguese, I was asked to deploy to Guinea-Bissau. Part of my 30-day mission was to assess laboratories, to determine Guinea-Bissau readiness to detect Ebola and respond to the Ebola epidemic in case Ebola virus would cross the border. In this image, you can see the border between Guinea and Guinea-Bissau. You can see how porous it is, and anybody can cross it. This rope is the border between the two countries. When I arrived in Guinea-Bissau and started working with the locals, I heard many times, God is Guineans. God is Guineans. God is Guineans. Imagine my surprise. Deus é guineense. Deus é guineense. How can it be? Really, where I grew up, I was certain that God is Brazilian. God is Guinean. Ebola won't cross the border. God is Guinean. If Ebola does cross the border, it won't spread. God is Guinean. If Ebola does spread, we'll be able to control it. I then realized these are people of immense faith, especially when considering that laboratory professionals in remote areas can run out of essential personal protective equipment, such as disposable gloves. Moreover, in remote areas, the only piece of equipment they have in the lab is a microscope, because it can use natural light when energy is not available. The technicians who are testing blood and other body fluids are at risk of acquiring laboratory infection, and, such as blood-borne pathogens. Can you imagine that, being part of your daily work? Yet, they still confidently declared, Deus é guineense. God is Guinean. I have never had an accident in the lab. While in Guinea-Bissau, I had to change my assumptions. I had to enlarge my view. I learned that, evidently, God has dual citizenship. How can I be so sure of this? I met an angel while assessing one particular lab. Does he look like an angel? You tell me after hearing what I have to say. Imagine these hardships. No water in the laboratory to perform a basic diagnostic test. Do you think that would stop him? No. Twice a day, he would walk 500 meters with a bucket to draw water from a well behind the hospital. No disposable gloves, no autoclave, no incinerator, no electricity. No help in the lab. He was the only lab employee. The day I arrived in his lab to do the lab assessment, the waiting room was full of patients who would come inside the lab because there was no more seats in the waiting room and sit on the floor waiting for blood to be drawn and tested. No paycheck for the past 6 months. Can you imagine working without pay for 6 months? I was floored. I knew working the lab requires dedication, but I had never heard of anything like this before. I had to ask, why do you do it? Why do you still work here? His answer was, that's my job. If I don't do it, the patients won't be tested. The doctor needs the lab results to be able to medicate them. These people are in pain. They are sick. They need treatment or they will die. It is my job to test them and provide results to the doctor. I was humbled. I witnessed people working very hard to do so much with very, very little. They kept coming to work because of the love of their people and the love of their country. Would you work in these conditions? I wondered, would I work in these conditions? Here in the US, we public health professionals are dedicated, but this laboratory technician made a huge impression on me. Because he had none of the advantages we have here, and yet he was dedicated to do his job, even without pay. What was incredible is that he wasn't the only angel who was willing to sacrifice in ways that we can only imagine. What I found is that this attitude was everywhere. What you are looking at is a lab book, heavily used, which you can say by how worn the pages are. The gentleman on the left is a lab technician who is almost blind, but he has drawn all these pathogens and cells to train his replacement. He has committed himself to laboratory training. Even though he is almost blind, he still wants to give freely of his knowledge to benefit his country and his people. He made me wonder, how far does our dedication go? While in Guinea-Bissau, I traveled around the country to assess several laboratories at the local, regional, and national levels. When I finished assessing the laboratories, I performed my gap analysis. I wrote recommendations to the Ministry of Health to address problems so they could better plan and develop their national laboratory system. Despite all difficulties, Ebola did not cross the border. What crossed the borders was the relationship that CDC and Guinea-Bissau's Ministry of Health developed with the ultimate goal of helping the country's capacity to prevent, detect, and respond to human threats. At CDC, we have state-of-the-art facilities, technology, safety and quality standards, and proficiency of subject matter experts. When we go on these missions, we experience temporarily harsh conditions, which are daily reality for them. In the end of my 30-day deployment, I had seen what many in this audience have seen, and met these angels that inspire all of us. When we are working in the field, we must be humble and look for the angels who are usually there, hiding in plain sight. They inspire us and remind us that miracles do happen, and sometimes it's because we refuse to give up, even in the face of adversity. To build capacity, it's necessary to understand the practical aspect of our work, as well as the people and the environment where we are working. The angels I met in Guinea-Bissau truly exemplified the reality and the efficacy of faith as a force for good. Thank you.